Heal stomach ulcers for good. Stomach ulcers, which are also known as gastric ulcers, are painful sores in the stomach lining. Stomach ulcers are a type of peptic ulcer disease. Peptic ulcers are any ulcers that affect both the stomach and small intestines. Stomach ulcers occur when the thick layer of mucus that protects your stomach from digestive juices is reduced. This allows the digestive acids to eat away at the tissues that line the stomach, causing an ulcered sore. Stomach ulcer can be easily cured, but it can be so severe without proper treatment. Stomach ulcers are almost always caused by one of the following: an infection with the Helicobacter pylori bacteria H. pylori, long-term usage of NSAIDs like aspirin, ibuprofen, or naproxen, which are non-steroidal anti-inflammatory medicines. The most typical symptom is a burning sensation or pain between your belly button and chest area. When your stomach is empty, the discomfort will typically be more strong and linger for a few minutes to many hours. With stomach ulcers, a multitude of symptoms are present. According to how bad the ulcer is, the symptoms will vary in severity. Additionally, typical ulcer warning signs and symptoms are: stomach discomfort that doesn't seem to go away with food or drink or the use of antacids, weight loss, a lack of appetite due to pain, nausea or vomiting, bloating, or heartburn, as well as pain that gets better with food or drink. Anemia signs and symptoms can include fatigue, shortness of breath, paler complexion, dark, tarry stools, and bloody or coffee ground-looking vomit. Ulcers were thought to be brought on by diet in the past. This is false, as we now understand. We also know that, even though the foods you consume won't create or treat a stomach ulcer, consuming a wholesome diet can be good for your intestinal tract and general health. It has been suggested that certain foods may aid in the eradication of H. pylori. Foods that may aid in the elimination of H. pylori or the growth of the body's own beneficial bacteria include leafy greens like spinach and kale, as well as broccoli, cabbage, and radishes. Apples, blueberries, strawberries, blackberries, raspberries, yogurt, and olive oil. Furthermore, avoiding hot and sour meals while an ulcer is healing is a good idea because individuals with stomach ulcers may also experience concurrent acid reflux disease. The following foods should be consumed in moderation by anyone trying to treat or prevent stomach ulcers. Milk. Despite being once recommended as a way to lessen stomach acidity and soothe discomfort, new study indicates that milk actually promotes the secretion of stomach acid and should be avoided by persons who have ulcers. Alcohol. Drinking too much alcohol can harm your stomach and digestive system, which increases your risk of developing ulcers and other serious illnesses. Foods that are really spicy or fatty. Some people may become irritated by foods that are extremely spicy or greasy. Depending on the person, chili peppers are an exception. Coffee and soft drinks can increase stomach acid production, even if they are decaf. This can irritate the stomach lining and exacerbate ulcer symptoms. Taking small frequent meals, digesting your food thoroughly, and eating slowly can all help to lessen pain and encourage healing in addition to avoiding the foods listed above. Prior to the development of antibiotics, doctors reportedly used it to treat stomach ulcers. Here comes the remedy. 1. Using cabbage. A well-known natural ulcer treatment is cabbage. Years before antibiotics were developed, doctors reportedly used it to treat stomach ulcers. It contains a lot of vitamin C, an antioxidant that has been shown to help treat and prevent H. pylori infections. As we have already mentioned, these infections are the most typical reason for stomach ulcers. Early scientific investigations on people found that daily ingestion of fresh cabbage juice seems to help heal stomach ulcers more efficiently than the traditional treatment at the time. Remedy 2 for ulcer. Licorice. Licorice root is said to offer both ulcer-preventing and ulcer-fighting qualities, according to studies. For instance, licorice may encourage the production of more mucus in the intestines and stomach, which aids in protecting the lining of the stomach. The additional mucus might also hasten healing and lessen discomfort brought on by ulcers. How to use. Get as many as licorice roots you could, turn to powder and take a spoonful with warm water.